All right, let's go. Good morning. My name is Ann Dominguez. I am from the Connecticut Department of Social Services. I am an eligibility services specialist in the Family Cash Unit in the Willimantic office. And joining me today is my colleague, Christina.
Good morning. My name is Christina Bellotti. I'm from the Waterbury Field Office. I'm an eligibility service worker.
All right, we're going to begin the presentation. Attending this overview of the Department of Social Services Public Assistance Programs. We know that many of you have experience with our agency. However, we do not know how much experience you may have on an individual basis. Because of this, we plan this session to cover an overview of how we are structured, the programs we administer, including some information on Access Health CT, how to apply, and finally, how to use our online services. We thought it was best to begin our presentation with our mission and vision. Our DSS mission is we, along with our partners, provide person-centered programs and services to enhance the well-being of individuals, families, and communities. Our vision is that we are guided by our shared belief in human potential. We envision a Connecticut where all have the opportunity to be healthy, secure, and thriving. Currently in the state of Connecticut, nearly 1 in 4 citizens are getting help from the Department of Social Services. Based on these numbers, it is critically important that each day we focus on the well-being of Connecticut's residents. The way that we are structured is we have had the same DSS offices since 2003. However, we changed our business model in 2013 to better meet the needs of our customers. Under our current business model, we have 3 main functions to facilitate better customer service. All 12 field offices have a service center. Services centers are available so clients may walk in and request services and be seen directly by DSS staff. In addition, all 12 offices have processing centers. This is the behind the scenes area where staff focus solely on processing the work of the agency. Finally, we have 3 benefit centers located in Bridgeport, New Britain, and Waterbury. Benefit centers allow consumers to speak directly with a DSS staff member via phone if they choose. And even though we are open for business in our service centers, since the start of the pandemic and reopening of our offices, we are encouraging a lot of online or over the phone and can be seen in offices if you need to schedule an appointment for something that is an emergent service. Before I go into how our benefit centers work, just want to highlight where all of our field offices are located. All of our benefit centers are open Monday through Friday from 7:30 to 4, with the exception of Wednesdays. Customers are encouraged to use online and phone services available prior to going to any field office if they're looking to get help through one of our service centers. All of our service center addresses are located on our website. And with the pandemic, one of the changes that DSS made is instead of being open Monday through Friday and benefit centers open Monday through Friday, Wednesdays we are now using as processing days. As you can imagine, there was a lot more need since the pandemic started. And so we have seen a great increase in the amount of work that can be completed by having those Wednesdays available for processing. Okay, the first program that I'm going to go over is the SNAP program. It's one of the main programs that we do, the SNAP, or Supplemental Nutrition Assistance Program. It is a federally funded nutrition program that helps low-income individuals and families purchase food. People who live, buy, and prepare food together get SNAP benefits together, and closely related people must get SNAP benefits together. I'm going to talk a little bit about that because this is always something that we have to explain in every application, every household. So anyone who is actually related to one another, husband, wife, children, whether adopted, biological, step, and anyone who may not necessarily be related in the same household, but if they buy and cook all of their food together, it is what we call a mandatory inclusion. So obviously at every single application, we inquire what the household composition is so that we can ask the right questions and make sure that the right people are getting their benefits together. We do count expenses such as rent, utility bills, medical bills in some cases, and childcare to help people qualify or increase the benefits. And medical bills, as long as there is someone over age 60 or considered disabled in the household, there is a potential deduction for medical bills as well. The benefits are issued via the gray EBT card. SNAP has a generous income limit currently set at 185% of the federal poverty level. Along with an increased income limit, the federal government removed a secondary net income test as well as an asset test. We do have some individuals and some households who still have these additional tests. Households that are comprised of only one individual that is elderly or disabled can actually have more than 185% of the federal poverty level, but they still have a net test, which is comparison after all deductions are allowed, and an asset test. Our income limits change in October every year when the federal government decides cost of living adjustments. So the benefits that I'm going to show in the next couple of slides will actually be adjusted as of October 1st. So this is the 185% of the federal poverty level income limit for SNAP. And so if households are approaching this income limit, but not over it, is when we can count deductions for things like rent and utilities, child support, and certain deductions. For the households that are over this income limit, as long as there's someone elderly or disabled in the household, then there's a potential that they can still be eligible for a small benefit. And that is also when we would look at if they have more than $3,500 in assets. Currently, these are the maximum benefit amounts. The maximum a household can receive based on the number of recipients. However, the amount a household can receive is based on a sliding scale. So a household of 4 may receive up to $782 a month, but if they have more income, it would decrease the amount they receive. So let's talk about this a little bit. During the pandemic, one of the things that were federally authorized due to the pandemic is that if a household was receiving less than their maximum benefit amount at the beginning of the month, when traditionally benefits are received, around the middle of the month, they were receiving an extra deposit on their EBT card to boost them to the maximum for their household size. Just a couple months ago, they also added an additional feature that if someone was already receiving the maximum for their household size, then they received an extra $95 around the middle of the month. And so these were temporary things that were put in by the federal government because of the pandemic. There is no definite time as to when these benefits are going to expire, but everything is based on the pandemic and how it is related to the federal government, and they make the determination if those extra benefits will continue. And these amounts do increase again as of October 1st. Okay, so that is the program. I'm going to hand it over to Christina so that she can tell you about the medical programs.
Okay, thank you, Anne. Like Anne said, I'm going to be talking about the medical programs. Let's see, programs determined by Access Health CT. And then on this slide, you could see where to access them, accesshealthct.com, or by calling 855-805-4325. And that is Husky A for parents, caregivers, children, and pregnant women, Husky B for children whose family is over the income limits for Husky A, they fall into the Husky B. There's also Husky D for adults without dependent children. And these programs are determined by DSS. There's also Husky C, which is disabled or aged. The largest program that DSS administers is the Medicaid. Now, what that means is two things to Connecticut residents. Historically, DSS is the sole entity to administer Medicaid. With the passage of the Affordable Care Act, states began transforming how Medicaid would be managed. In Connecticut, that means a partnership with Access Health CT or Access Health, like I talked about in the slide. For now, I'd like to focus on the programs that would be solely administered by DSS. Medicare versus Medicaid. Let's see. So the client goes through a means test. This means that income and asset limits to determine eligibility. They fall under the asset limit of $1,600, and that's for a single adult. Medicaid, which is Husky C and Husky D, a benefit that requires an application. Also, a benefit that pays for most medical services, including the cost of care in a long-term facility. Now, I'd like to talk about the Medicare Savings Program. DSS will pay for a qualified recipient's Medicare Part B premium each month. Some enrollees will additionally be covered for Medicare deductibles and coinsurance. must be a Connecticut resident, Medicare Part A eligible, a U.S. citizen, or legally in the United States for 5 years and under income limits. And the Medicare Savings Program is funded by Medicaid. Medicaid for elderly and disabled. Many parts of Medicaid are now processed with the help of Access Health, including families and single adults. The one area that seems solely with DSS is Medicaid for people that are either elderly and or disabled. For Medicaid, elderly is considered 65 or older. Individuals who are disabled and are between the ages of 18 and 64 are also part of our direct administration. I also want to point out that disability is determined by the receipt of Social Security disability benefits under SSDI or SSI, or by medical determination through our agency. This medical program is based on income and asset limits. And as you can see here, in order to qualify, assets must be below $1,600 for an individual or $2,400 for a married couple, and some property is excluded, and usually one vehicle. What is a spend down? So you can have a spend down in Husky C, and it's when a client is over the income limit, but meets all the requirements. When talking about Medicaid for individuals that are either elderly or disabled, we usually move into a conversation about spend downs. And we're going to spend a little bit of time on this. Spend downs are created when a person applies for Medicaid, but but his or her income exceeds the limit of the program. Let's take a closer look at and see what that really means. What is a spend down? Person is over the income limit but meets all other requirements. And it's also similar to a deductible. Person must spend down the amount which is over the limit before medical coverage can start. And this is done within a 6-month period. And it exceeds for 1 month the spend down amount. So you actually have to meet this amount every 6 months is what that ultimately means. And the spend down can be small or large, that the spend down amount. See, our state is broken into 3 regions, and there are slight variations between Region A, which covers Lower Fairfield County, and the remainder of the state. If you're curious, the majority of the state falls under Region B, while the northwest corner encompasses Region C. So as you can see in this chart, it kind of goes over some of the income limits. Slightly different, depending on where you reside. Here is a very simplified example of how a spend down is generated. Let's suppose that a person's net disability income is $917 a month. I already shared that the majority of the state has a net income limit of $531.96 for a single person. And it's just a bit higher for Lower Fairfield County. That client's access is just under $24 a month, or nearly $139 for a 6-month spend down period, which is how we use the spend down eligibility cycles. And as I said on the previous slide, a spend down is like a deductible. So once the client has incurred that $138.24 in medical bills, the Medicaid is activated for the remainder of the period. And any additional bills will be covered for the rest of the eligibility cycle, which meaning that the eligibility would then kick in. The client's living arrangements affect the spend down, as there are 2 income disregards for clients living in the community. It's $362 for living alone and $429.90 for shared living. Another Medicaid program that we administer for individuals with disabilities is our MedConnect programs. This is also referred to as Medicaid for employees with disabilities, and it allows individuals with disabilities to be employed without risking the loss of Medicaid benefits. This program, the income limits are slightly higher and the asset limits. At the agency, we call it an SO5. And that's how it's known to our eligibility database. MedConnect is from ages 18 to 65, disabled per Social Security or DSS, must be employed, gross income under $6,250 a month or $75,000 a year, assets under $10,000 for a single adult and $15,000 for a couple. Premiums, if income is greater than $2,147 a month for an individual, and for a married couple is $2,904. Okay, and these are some cash programs that we have. And Anne is actually she's a family cash worker. So if you have any questions, feel free to ask her. So let's look at some areas of DSS programs. As you can see, we have specific programs for families, which is called the temporary family assistance. And then we have specific ones for individuals, which are it's called SAGA Cash and State Supplement. And then also it's good to note too, for all of these programs that veteran benefits are considered countable income. So if you do receive VA benefits, that we do use that as income to determine eligibility. And all of these programs do have specific income limits. So if you would like to apply, we encourage you to apply and see how it goes. Cash assistance for people with disabilities or age 65 and older. There's aid for the blind, disabled, or state supplement, which I talked about in the previous slide. Individuals can qualify if they're 65 or older, if they are blind, disabled, again, in between 18 and 64 per Social Security or DSS. And as I was talking about earlier, all the income is kind of calculated to look at that. And another staple to it is it does there is a medical piece, a medical insurance that comes with it. What if you're not a family, elderly, or disabled? So another cash program is available. And this cash program is called SAGA Cash. And there are some, requirements for the SAGA Cash. And for this program, it is the same. You fill out an application, and in the process, there is an interview, that can be done over the phone or in person if needed. So SAGA Cash. So SAGA Cash is considered last resort. It's paid 100% by the state of Connecticut. As of 12/1/2014, 6,409 individuals received benefits from this program. So in this program, the benefits are $55 per month if an individual does not pay any shelters, and then 219 if an individual does pay for shelter expenses. Because SAGA is for individuals that are not elderly or disabled, it is sometimes called the program of last resort, like how I spoke about. And this whole program is entirely funded by the state without any federal reimbursement. So I often tell individuals it's almost like a loan, because one of the requirements is to that you have to apply for Social Security. So until your Social Security kicks in, then you know, if you're eligible for the SAGA cash, you receive the SAGA cash. And then once you do receive Social Security, then that's when you have to pay the state back. Now, if you qualify, it is worth noting that the maximum benefit is $219, like how I spoke about, and the minimum benefit is $55 a month. So in order to qualify, an applicant must be unable to work for 2 to 6 months and has recent work history. 2, unable to work for 6 months or more, no work history required, but medical review is required. Under the age of 16 and emancipated by the court, age 65 or older, 55 or older, and has worked less than 6 months in the last 5 years, or a full-time high school student, caring for a incapacitated spouse or child, caring for a child under the age of 2, or a VISTA volunteer.
Before we start talking about the general application process, these cash programs are, the information here that we provided is kind of tied into some of the other cash programs. So as a family cash worker, we didn't really go over the temporary family assistance program. A lot of the veterans are, you know, single adults, and would be mostly looking at either the state supplement cash program or the SAGA program. And so this in here for caring for a child under age 2 is a very specific scenario for a family who has applied for cash assistance and does not particularly qualify for one reason or another from one person in the household that is not married to the applicant with income. So it's a little tricky there. And so there are other qualifications here for people that can be eligible for SAGA that you know, in all other scenarios, we would think would be eligible for family cash. And so some of these require the application for Social Security. If it's something short term, we don't necessarily require that. And so this is one of the most important reasons that we require an interview for these cash programs, so that we can ask all of the relevant questions to determine which cash program someone is available for. So that was an overview of the programs. And so now we're going to talk about how to access the programs, which is one of the most important things that you will need to know. We do accept online applications at www.connect.ct.gov. And that's right on our main page. The first link that you see in the white section of the page is to connect to DSS. I do have some screenshots of that as well. We do still accept a completed application type W1E for any program, or W1 QMB if you're specifically applying just for the Medicare Savings Program. And the address there is our scanning center. It is everything that you want to submit to the Department of Social Services. That is the address that you want to use. If you're requesting long-term services and supports, either for someone in a long-term skilled nursing facility or a boarding home, or someone who needs more hands-on care in their home, in the community, it is a W1 LTC application. And the application hubs, you know, depending on what region you live in, you would want to check that website to see where is the correct office to send an application for the long-term care programs. And obviously you can call the benefits center to verify, you know, where you can send an application. But the online process is going to be a lot about what we're going to talk about today, because especially during the pandemic, people that would normally have come into the offices or send in a paper application have been pleasantly surprised with the speed of processing things by submitting them online, especially during this time. So the great thing about the DSS My account is it gives you direct 24/7 access to DSS for customers and community partners. It's an online account with a secure user ID and password. And once linked to a client ID, can provide benefit details and status of documents submitted. So it can actually show when renewal cycles are due, notices that we've sent, requests for verifications that we've sent, requested proofs. All of that stuff is in there once the online account is linked to the client ID. It can also be a quick, direct way to send applications, renewals, changes, periodic review forms to DSS. Supporting documents can be uploaded. And one thing to note about this is that when you're uploading documents to your My Account, if you want to take a picture of something, that is absolutely fine to do that. But that picture needs to be converted to a PDF file type. So lots of smartphones already have Office apps, or you can download a free one from the App Store. But in order for things to be uploaded successfully on your end and for us to be able to see them, they need to be in a PDF form. Budget sheets or housing letters, benefit summary letters, that normally people call the benefit center or come into the office to request, you can actually print them yourself from your online account or save a PDF and send it to your housing office or whoever may need them. DSS receives online submissions quickly on the same day. It used to be that online submissions would batch 2 or 3 times a day, but now as long as you hit submit, those things are coming to us right away. So sometimes we'll be on the phone with a client and we'll say, okay, you still need to submit whatever the verification is. And they say, okay, I'll do it right now. Sometimes that verification becomes available to us while we're on with the phone with the client and can process it right there on the spot. So the online account is a great feature to be able to use. And so setting up a My Account is just go to our website. And again, where the link is the first one on our main website, click on create an account in the My Account box. Please link your client ID number with your My Account at the Associate Cases area. If you do not yet have a client ID number, you can update your My Account later to associate it with your case. So if you have just applied for benefits and you have not been an applicant in the state of Connecticut before, you very well may not have had one. So if you're calling the benefits center to do an interview for a new application and you're brand new to us, make sure you ask them for your client ID number so that you can associate your case when you log back in there. Again, the things that you can do once you're associated is apply, renew, complete your periodic review forms and report changes, upload all of your supporting documentation after initiating a submission. So you either have to report an online change or be submitting one of the other application or renewal types in order to upload documents. You can't just upload. So a lot of times people will report a change and upload their documents with the change. You can check benefit details, check your document status, request a fair hearing, switch to paperless notices, and generate a benefit summary letter or a budget letter. The important thing is email addresses can only be used once when signing up for a My Account. So a lot of times clients will say they created one a long time ago and they're not sure how to log in. The 1-800 number for technical support to be able to unlock the account you previously created or assist you in updating your account, I'll be showing in that in just a minute. So this is what, once you click on that link from our main website that says Connect to DSS, this is the page that you're going to see. And so in the red circle there, if you're new to Connect and you haven't had an account before, you click on Create Account. Okay. And see, once you're logged in, if you have not previously associated your case, in the red arrow shows you where the case association link is going to be. So in this case, if you have submitted a new application or if you skipped typing in your client ID during your registration of your online account, then this is where you would go to do that. Okay, and some of the things that you can see when your case is associated. So this is what a case would look like. And in this case, we can see that they have active TFA, they have medical benefits for state supplement and medical. And this, because we were talking about before with cash programs, not necessarily would always see these two programs together, but let's say the head of household is an SSI recipient, the remainder of her household could be eligible for TFA, and she could personally be eligible for the state supplement and cash assistance. Or this could be a guardian household where the head of household is not active on the TFA for themselves, but can be active on state supplement cash for themselves, just as a side note. This also shows documents that have been received by the agency. And so if you look at the document types there and the document status, it tells you when we received the document. And that very bottom one there where it says demographics and ID, it shows reviewed. That's also a great tool for clients when they're submitting documents. They can see all of the things that we have received in there, but it'll flip to reviewed, and that's how they know that we have looked at it. So they can expect to see a notice of action or benefits being granted or another notice from us. So that is another great tool with this online account. Okay, in the middle of this slide, so this is talking about creating an account, but in the middle of this slide is where the phone number is for technical support. So that's something that you want to probably jot down somewhere so you don't have to refer back to this all the time. And so if you're having issues either setting up your account or have been locked out of an account previously, then that's the phone number that you would want to use. And then on the right, it also talks about renewals. There's a whole section that will start to appear when a renewal is due. So DSS issues renewal forms about 45 days before the end of the month when benefits are expected to end. So if you know that you have a renewal due at the end of October, by around September 15th or 18th, you can start looking in there and be able to complete that renewal online without having to wait for the mail to come. Okay. And for this section, we're going to talk about applying for benefits. So if you haven't ever had anything before, a lot of times people just go in and apply, even if they have had an account or have current benefits with us. Results in the applications coming in, sometimes with just the client ID number, sometimes just the person's name, and then we manually attach them to the cases after the fact. But let's look at applications. Okay, so once you submit an application, the one thing that you notice here is the online submission ID. So if you need to contact DSS and you don't know of your client ID number, or if you haven't had one before, one of the ways that we can look up your application to be able to pull it and screen it for you is with that online submission ID. A lot of times also, if someone is applying brand new, or they applied and their application was not previously associated to their case, sometimes what happens is all of the remaining documents that come in also will only be attached to the online submission ID, not your client ID number. So that's always a good number to keep handy as well when you're trying to contact us to process something for you. So if you apply online, you have a receipt of the date and the time it was submitted. It is transmitted directly into the DSS system, Impact, with no need for scanning or any mail lag time. An application ID is provided that can be used when calling DSS, like I just talked about, and this is helpful when there's not yet a client ID. You can start the application, save it, and then return to it once you know all of the answers to all of the questions, and verifications can be uploaded where they will electronically attach to the application. So DSS is diligently working towards being current in all programs. Connecticut is among the top in the nation for processing SNAP applications. And our Medicaid application processing time is also meeting timeliness standards as applicants using the Access Health system get immediate eligibility determinations. And we have made great strides as well on Husky C and long-term care applications. This is a closer look at the renewals function. And again, this will probably not even show up in your online account if you do not have a renewal due at the time. So same thing, complete the renewal. It generally comes filled out with a lot of your information, and it just asks you yes or no questions if there are any changes. If there is a change, that's when you would want to indicate it for us. And if possible, upload any supporting documents if you've had a change of address in the last year, if you've started a new job, address verification for the new address, pay stubs for your new job. Any of those things should be uploaded when you're reporting changes. Now, periodic review forms, we haven't seen these in a while since the pandemic started, is one of the things that the federal government gave us a waiver on nationally, so that periodic review forms during this time were not having to be completed. There was a lot of automatic renewals that were extended just because there was so many people applying. So periodic review forms were suspended. As of now, it looks like they're coming back for next month. So those can also be submitted online as well. And those are just 3 or 4 questions asking if there have been any changes in your household. Okay, and reporting a change. And so there are lots of checkboxes that you can indicate that something specific has changed, like someone moved out, someone moved in, your address or phone number has changed. And again, a lot of times we see these with actually no changes reported, and people are just using these to submit verifications. But there is a spot where you can actually write what your change is if it doesn't fit into one of these actual categories. Okay, and for budget sheets. So my account users that have associated their client ID to their account can now produce and print budget sheets, also known as HUD letters. A lot of the housing offices ask for these by clicking on the details magnifying glass. And so you see here with the red circle and the yellow arrow that if you click on that, then you can actually print yourself the budget sheet or the verification letter. So we call it the proof of benefits letter, even though we used to call them budget sheets. And there's a sample of one of those letters on the right hand there. Okay, uploading documents. So in this top section here where it says verification documents, it tells you what category it is. In this case, address and citizenship, and it tells you what things you can provide to verify those. So it's not just one specific thing. It'll actually list all of the same things that are on the notices that go out in the mail to tell you what things you can submit to us to satisfy the requirements. And then on the bottom in the big red circle, this is where it gets a little tricky for people sometimes. If you're doing this from a smartphone and you have a picture type that's a JPEG file type, they need to be saved and converted to PDF before they will successfully upload. But that is the spot that you can do that. And once you get the hang of it, it really is a great feature and fairly easy to do once you're used to doing the conversion to PDF. So we do have several helpful how-to videos on our website, creating an account, resetting your password, retrieving your user ID, reporting changes. And I believe there's one now for uploading documents. Like I said, is usually the trickiest one for people. If for some reason you want to mail something to us and you don't have an online account to be able to do it online, this spot here, right under the blue box in this Connect website, it says mail documents to DSS. And so this is a way for you to give us your name and your client ID number before sending something to us. And so this is what that page looks like. So it's important, obviously, to spell the name correctly. And if you don't have a client ID number, then don't put in something that looks like a client ID number, because then it's not going to attach to your case at all. But if you have your EBT card, that part in the middle of the card that starts with 00 or 10, that's the client ID number that you can use to put in there and mail something to us that already comes with a cover sheet and a barcode to attach it to your client ID number. One of the other great features that we have that's 24/7 is our IVR system that is attached to the Benefit Center. So you start with our 1-800 number, and the client information line is an interactive voice response system. So clients can also set up a secure PIN to check on their benefit status and details anytime. And so what they can do with that PIN number is check the benefit status, review the benefit details, and monitor the document status. So a lot of the same things that you can see on the online account, you can actually review over the phone as well if you set up a PIN. So all you need is your client ID, your date of birth, and the last 4 digits of your Social Security number. And if you are dealing with someone who is undocumented and doesn't have a Social Security number, generally in place of those for activating EBT cards, and in this scenario, it would be 4 zeros if you're dealing with a client that has that scenario. Okay, and this is a great way to get the information you need without waiting. So open the DSS phone account and set up the IVR PIN. Call the 1-800 number after listening to the welcome message. Press 1 for English, 2 for Spanish, and follow the voice prompts on the main menu. Enter your 9-digit DSS client identification number found on the Gray Connect card or on the upper right-hand corner of most notices obtained from DSS. Choose a personal identification number and choose your PIN carefully, as it will be required each time you call the DSS information line. Little thing to tell you is that we have new options for our benefit center that are now in place. Now, if you call the benefit center, and the new options are, you can speak directly to a long-term care facilities or residential care homes line, a community-based options line, and temporary family cash assistance line. So if you've called the benefit center plenty of times before, just make sure you listen to the prompts because we have updated them. And so, for example, it's option 3 if you need to talk to a family cash worker. And another thing that we have done to improve customer service experience, we also now offer a callback option. It's called virtual hold. Instead of waiting to speak with an eligibility services worker in the benefits center, you can choose the callback option, and your spot will be reserved through our virtual hold technology. And you'll receive a call back when it is your turn in line to speak to an eligibility services worker. And this has actually been pretty seamless for the clients. We get the calls at the benefit center, and the person has not been on hold for as long, and so it'll tell us that it's someone who's getting a call back. But so far, we've been doing a lot of things to try to make it easier for people to get a hold of us. Okay. So Christina, you actually work in a benefit center. Is there anything else that you would like to add about, a lot of things that you have to tell people, or anything specific coming? I answer the phones, but only on a rotational basis because I'm a cash worker. But you as working in the benefit center all the time, is there anything else that you'd like to add that you see on a daily basis?
Sure. So actually, yes, regarding the virtual holds. So when it's time for you to get that call back, if you do miss that call, it will call you up to 4 times. So, if say your whole time was an hour, the hour comes, it calls you back for whatever reason you missed that call. Don't get worried, it will call you again. And like I said, it will call you up to 4 times.
Okay, that's great.
So that's one thing I just wanted to kind of point out. If you can, to always, to have your client ID number with you, and to punch that in, because then that just, it kind of expedites everything, that process. I think that.
Okay. Well, when they put in the client ID number, it gives us what we call a screen pop, and it actually will list the client's ID number, their name, and any recent documents that have been submitted. So, we have a lot of tools available to clients now with the online system and the phone system and the IVR. So, on top of, reviewing our programs, but one of the most important things that we want to make sure we tell people is to use the tools available.
Yep.
All right. And in closing, DSS serves up to 1 million residents in all 169 Connecticut municipalities. We support the basic needs of children, families, older and other adults, including persons with disabilities. And services are delivered through 12 field offices, central administration, and online and phone access options. All right. Okay. And we are back. So that, unless we have, a question from somebody from veterans that would like to ask us something, then we are all set for today.
I'm good. I typed my questions in the chat already, so I think I'm pretty good.
Okay. Oh, there was a lot of chat going on. Okay.
Yeah, we had some chatting going on there, so that was good.
Well, that's why we had Michelle.
She did an awesome job. Oh, someone's typing now.
Yes, I think Bill has his hand up.
Oh, he does?
Yeah. What are the new limits, EBT limits for, you mentioned October 1st. What are they going to be for a household of 1?
I believe that it's 242. I'd have to look at an actual case that was just processed. So they're increasing. They usually increase by $15 or so. But I can get you that actual amount. Just a minute. Maybe Michelle will answer it too.
Okay, thank you.
And they will be posted on our website as well too. That's one of the things, because those are federally, so that's something that should be available to us everywhere. Okay. Anybody else? All right, well, then I think we're all set. If there's any more questions in the chat that I can still answer, I will do that. But otherwise, I think we're good.
Great. Thank you so much, ladies. You did a wonderful job. Really appreciate it.
Thank you.
Thank you.
All right, everyone have a nice day.
You as well. Thank you.
Yep.